Hi, this is Michelle Cotty, and today we're going to be talking about personality disorders. The objectives include defining personality and identifying similarities and differences between the different types of personality. In particular, we are going to examine borderline personality and antisocial personality because those are two of the more prevalent personality disorders in hospital or prison situations where you may be employed as a nurse. The word personality was originally derived from the Greek term persona. It was used to describe the mask worn by actors, and over time, it lost that meaning and came to represent the person behind the mask or the real person. Personality is the totality of emotional and behavioral characteristics that are particular to a specific person and that are somewhat stable and predictable over time. A personality disorder is a pattern of inner experiences and behavior that deviates from cultural expectations, which is another reason why culturally appropriate care is so important. Now, personality traits are characteristics which an individual is born with or develops early in life, and they influence the way that he or she perceives the environment. When these traits are rigid and inflexible and maladaptive, it can impair functioning, and that's when we call it a disorder. So the most common symptoms that you'll see in personality disorders are impairment in relationship functions. So 41% of people would experience that. Dysfunctions in thinking at 30%, affect, 18%, and impulse control, 6%. And if we're thinking about Erickson stages, remember that when we are not achieving each stage successfully, that we can have maladaptive behaviors, and we'll talk more about that momentarily. So personality disorders are classified in clusters. Cluster A, autoeccentric. Cluster B, erratic or dramatic. Cluster C, anxious or fearful. Personality is formed by our genes, our environment, things that we learn, and personality disorders are our response to stress, and they're maladaptive often. Well, if it's a disorder, it is maladaptive. And it's often a response to chronic trauma that is experienced in childhood, which is very sad. So if you recall Erikson and the different stages, you can see that ages 2 to 4, you're supposed to develop will. So if a child is developing a sense of independence and personal control, that's successful. If they unsuccessfully complete that stage, then they're going to have either maladaptive behavior, which could be impulsive, or malignant behavior, which is on the negative side, which is compulsive. So maladaptive is too optimistic, malignant is too negative. So impulsive or compulsive. If you think about 20-year-olds, and I marked out the 20 to 40 and the 40 to 65 because your book has different dates. I believe it ends at 30. If you think about people in their 20s who are trying to navigate the stage of intimacy and versus isolation, on the maladaptive side, they might be really promiscuous if they don't complete this stage successfully. And on the malignant side, the negative side, they might experience something called exclusivity, which means isolation. So if you just kind of keep that in mind as we progress, you don't need to know this for your exam, but think about where do personality disorders start and why do they start? And this is why. Somewhere in a psychosocial development stage, and these are Erickson stages, something went wrong. They did not complete the stage. Often what went wrong was trauma. And because of that, now they have some personality disorder. So let's review again. Personality is the totality of an individual's behavior and emotional characteristics. It includes our genetics, life experience, and learned behaviors, unfortunately sometimes learned from trauma. Our temperament might be the most influenced by genetic predisposition, with the exception of drugs and alcohol. And this discusses or defines our emotional, motivational, and adaptive traits. And of the 4 traits, think of them on a scale. So harm avoidance, novelty seeking, reward dependence, and persistence are the 4 categories under temperament. And each of those things are on a scale for individuals. So harm avoidance, some people are very timid, some people are very risky. Novelty seeking, some people are passive, some are really intrusive. Reward dependence, some people are indifferent, some people are indulgent. And persistence, apathy to fanaticism. Our character is about how we control our basic drives. So aggression, hunger, greed, and sexual pleasure. Individuals with severe character flaws may lie, cheat, steal, injure other people, and exploit others to gratify their own needs. They lack a conscious or this internal sense of values, empathy, and concern when it comes to the right of others. Often they can be self-centered, self-gratifying, and focus on self-preservation. So next we're going to look at one of a slide based on one of my favorite books. And the book is called Fatal Flaws. And I have it here. It's called Navigating Destructive Relationships with People Who Have Disorders of Personality and Character. So it's if anybody likes to read in their spare time, I know in nursing school you don't have a lot of that. Fatal Flaws is a book I highly recommend. So Fatal Flaws discusses personality disorders as brain dysfunctions of thinking and impulse. And this leads to persistent patterns of personality and behavior that can betray the trust of people in our lives and destroy relationships. The cause can be hidden and it can be confusing, but it creates wreckage that causes pain and suffering to many people. Now, nobody has a perfect personality, so what makes it fatal? 1, the person has to deny the problem. 2, they do not want to change. The personality issue is something that cannot be corrected, and there's a high probability of future physical harm and violations of the law. So there are general diagnostic criteria for all personality disorders, and this slide reviews those. So these are things that they all have in common. Minor stress is poorly tolerated. They're not psychotic disorders, and they usually begin in childhood or adolescence. First, it is an enduring pattern of feeling, thinking, and behaving that deviates from the expectations of a person's culture. And that manifests its way in at least 2 of the following areas. Cognition, which is the way of perceiving and interpreting self, other people, and events. Affect, so it's like emotional range. Intensity, volatility, and appropriateness of emotional response. Interpersonal relationships or impulse control. So this pattern would have to be manifested in at least 2 of those areas. The pattern of feeling, thinking, and behaving is inflexible, and it is exhibited across a broad range of personal and social situations. The pattern of feeling, thinking, and behaving has to lead to distress in the individual and others, and to impairments in interpersonal, social, school, or occupational functioning. So if there's no distress and no impairments in functioning, it's not a personality disorder. D, the pattern of feeling, thinking, and behaving is enduring, and its onset can usually be traced back to childhood, adolescence, or early adulthood. And the dysfunctional pattern of feeling, thinking, and behaving is not caused by another type of psychiatric disorder, and it's not a consequence of a medical condition such as a brain injury. Now remember, responses happen on a continuum. So there are adaptive responses and maladaptive responses. And if we're thinking about culturally competent care, we need to remember that areas of importance, such as language, tradition, values, religious beliefs, morals, gender, sexual orientation, and socioeconomic status, they vary depending on the culture. So areas of importance must be considered when considering diagnosis of a personality disorder and incorporating that into a treatment plan. Some cultures promote individuality, while others promote close family bonds. Eastern cultures might feel that the mind and body are one. Western cultures feel that they are two separate entities. 35% of the US population is going to be ethnic minority groups by 2025. So it is important that we have cultural context and we take that into consideration when we are diagnosing somebody with a personality disorder, because remember, it has to be something that is not culturally appropriate. When we're thinking about maladaptive responses, remember repression, suppression, regression, undoing, and splitting. Splitting is something that many psychiatric nurses in the hospital get to experience when they work with borderline personality disorder patients. So often they try to divide the staff, and one moment they'll tell you that you're a great nurse, and the next moment you're the worst nurse that they've ever had, and they're telling everybody. So splitting is something that you might want to read about more in your text, because it's something that you may get to experience as a nurse. When we are thinking about treating personality disorders, medication is not always the answer. While medication might help with anxiety and aggression, it is ineffective to treat the actual personality disorder. And what these individuals would benefit most from would be therapy, therapy, therapy. Now we're going to examine